conference in Mexico, and good morning to all of you in the audience. Here in the Netherlands, it's the end of the workday, but your day is just starting. I will start by sharing my screen. Just give me a minute to set up here. Okay. So good morning to all of you. As Raúl introduced, as far as I could follow the Spanish, I'm a professor of vitality and aging from the Netherlands, Países Bajos, trained as a medical doctor, but now working not on treating and healing patients, but on keeping people healthy for longer. And I do this from a joint position, both as a professor in public health and primary care, and from a position at the Leiden Academy on Vitality and Aging, which is a knowledge institute where aging is studied from a multidisciplinary perspective. So I work there as a medical doctor, but many of my colleagues are psychologists, anthropologists, and all of us study aging. We have a societal mission. Our mission is to improve the quality of life of people. And of course, we are a knowledge institute, so we have all the layers, all the echelons from professors to PhD students to students. But we also devote a lot of time towards the implementation of scientific knowledge into the communities into in the end improving the quality of life of all the people. So the title of today's talk is a community-based experience, and I will start with two persona that I would like to introduce to you, two persons that I have met that have changed my view of vitality in my professional career, and to take that as a problem analysis and also as a vision for a solution. So the first person I'd like you to meet is Hans, and Hans is a patient that I met when I was a young medical doctor in the hospital, and he was a very kind and humorous person. But as you can see, he is holding this paper towel. He's been a former smoker, as many men of his generation in the Netherlands, and from that he has developed chronic obstructive pulmonary disease. So he's always coughing a little bit, and as you can also see, he is overweight, and as a result he has been suffering from type 2 diabetes for over 20 years, and as a result of that his cardiovascular status is far from optimal. And when I met him at age 68, he had just had his first myocardial infarction. And I still remember the day that I met him, and when I brought him back from the consultating room to the waiting room, I called in the next patient, and that patient was also called Hans. And that was just a coincidence. It's a common name in the Netherlands. And when I looked at his medical file, he had similar conditions: a former smoker, overweight, cardiovascular disease, diabetes, and hypertension, high cholesterol, etc. And when he stood up, he also looked like Hans. And when I looked around in the waiting room that day, I noticed it was filled with people like Hans. And somehow that was an important day for me, because yeah, this is how we grow old in the Netherlands or in the modern world, and also in Mexico. When you reach the age of 70, 70% will have hypertension, 2/3 will have obesity. The type 2 diabetes is a very common, and cardiovascular disease is one of the leading causes of death. Many of my colleagues are now devoting their time to treating people like Hans. But the reason that I have left medical practice and devoted myself to the study of vitality is that I met this person. and this is Kwaku. And Kwaku is living in the north of Ghana in West Africa. I worked and lived there for 5 years during my PhD work. And Kwaku is 20 years older than Hans. Hans was 68 and Kwaku is 88. And I also remembered the first time that I met Kwaku. He was plowing the field next to his farm. And that was done just by manual labor. So he was really working the field and sweating a lot. And it was intense physical exercise. And I was struck by the fact that a man of 88 years old could be so physically fit. And when I was living and working there longer, I noticed that just as Hans was not was not uncommon in the Netherlands, the same applied to Kwaku. Kwaku was also not uncommon in Ghana, because I've also brought you the friends of Kwaku, and yeah, I took these pictures because I thought these people, you could see from their portraits, that they had lived under the African sun their entire life and worked the field. But as a young medical doctor, I was intrigued to see if not only they had aged beautifully on the outside, but if they had also aged beautifully on the inside. And so we studied over 1,000 older Ghanaians like Kwaku. What does that look like? This is just a small field laboratory that's traveled around in the research area. We had an area where we followed all the different families, 30,000 people for 11 years for different research questions. And all the older Ghanaians were asked to participate in these medical examinations. So this man here is undergoing an EKG recording. There's an ultrasound to investigate the vessels in the legs. Did blood tests, measured blood pressure, and all other sides of all other sorts of anthropometrics. And when you have about 1,000 of these older Ghanaians on your couch like this, yes, you find all sorts of diseases. Malaria, typhoid fever, all sorts of parasitic diseases, infectious diseases. But the diseases that I had seen during my medical training in the Netherlands, every day, everywhere, type 2 diabetes, cardiovascular, those diseases were rare. Of the 1,000 people that we took a blood sample from, none of them had abnormal blood glucose levels. And also, if you studied the arteries in the legs with the ultrasound machine, you would see, so this is peripheral arterial disease we're talking about. If you do this as a population study of free-roaming people in the United States, you'd see that with progressing age, more people will have damaged arteries in the legs. And at age 85, this is measurable in 25% of the people. When we did this in Ghana, yes, we also saw damaged arteries in the legs every now and then in 3% of cases. Meaning that from 1,000 people, 970 had perfectly healthy arteries in the legs. When we did the EKG recordings, we noticed that this is not only true for the arteries in the legs, but also for the coronary arteries around the heart. And this was a striking finding because if you think about the amount of energy that we devote in our medical system to the treatment of cardiovascular disease, from all the AEDs everywhere, the ambulances, the PCTA rooms, the stands, all the different pills, etc. For a disease that is almost not a public health issue in Ghana. So, what can we learn from people in Ghana? What is their secret? What is the wonder, the vegetables that they grow there, and where can we order them? Well, as you probably guessed, it's nothing to do, not only to do with what they grow here, but the fact that they grow it here by hand. They work on the field every day, and because of that, they are physically very fit and active. And what they eat is what they grow on the land. And most importantly, there are no chocolate, cookies and Coca-Cola growing in these fields. If you look at these small children, they have plant-based, unprocessed foods, low in calorie density. And well, these children might not look very slim, but they're in fact malnourished. So they have a bit of edema. If you measure their upper arms, you'll notice that they're underfed. We also measured the BMI of the entire study group. And while BMI, as you know, should be between around 20 to 25, in Europe and US, it's 26, 27, 28. In Ghana, the average BMI was 18.6, so indeed a little bit low. We also performed different types of blood tests, and there were also some striking findings. For example, in the glucose metabolism. Now, if you measure glucose in Europe and the United States, you find an average glucose level of between 5 and 6. In Ghana, the average glucose level was around 4. So they have a different set point, a different way to manage glucose levels. And that's not only true for glucose metabolism, but also for the fat metabolism. If you look at the total cholesterol, that's between 5 and 6, also in Europe and US, there was around 3.2 in Ghana. So a total cholesterol of 3.2. Okay, so to set the stage, two people who have aged in a very different way. Hans on the right side, 66, but with many different types of ailments and problems. And Kwaku of 68 and Kwaku at 88, 20 years older, but still physically fit, working on the land every day. What is now, if we come to a problem analysis, what is the reason that these two people age so differently? Well, one could say, yeah, it's because of their lifestyle. If Kwaku, or if Hans would not have smoked, and if he would have worked on the land more, yeah, then he would have aged more like Kwaku. Is that true? Yeah, probably. Yeah, yes. Some would even argue that because of this, it's partly Kwaku's or Hans's own fault that he aged in this way. But I have a problem with this line of thought and this way of reasoning, because even though the way they have aged is partly the result of their lifestyle, I have difficulty concluding that therefore it is their own fault, because their lifestyle is so much dependent on the place that they live and the place they were born. And if you would have taken Hans as a young boy to Ghana and he would have lived there, he would have worked the land, he would have aged much more like a Kwaku, and the same applies to Kwaku. In fact, many people have been enslaved from Ghana and transported to the United States in past centuries, and the Afro-Americans, they all age like Hanses. So it's also not true that it's the DNA, the Ghanaian DNA that makes these people age so differently, because people from West Africa, when they live in an environment like the United States, they'll all age like people like Hans. So in my analysis of the problem is not in the persons per se, but in the environment that they live in. And here you see the farm that Kwaku lives, in the lower left corner, and a modern city, which could be Mexico City or Amsterdam or whatever modern city you can think of. And truth is that the environment that Kwaku lives in is still very similar to the environment that humans have lived in for tens of thousands of years. And our bodies have evolved to survive such an environment, there's a reason that we have glucose receptors on our tongue, that if we detect something sweet, that they're wired to the brain, that makes us happy if we eat something sweet. That is because sweet means sugars, sugars mean calories, and calories are needed for survival. It's a survival mechanism in the original environment. However, that same mechanism is a problem in the modern environment. The environment changed very quickly, but our bodies have not changed. I'd like to do a small experiment with you to demonstrate this. Look at this delicious strawberry cake, and imagine that the smell of this fresh cake is still in the room somewhere. And imagine that you take a bite out of this sweet and delicious cake, and you taste the sweet strawberries in your mouth. The mouth-watering effect of only this illusion or the visualization of this, that these are our old genes telling us that this is a healthy choice. Take 2 pieces. The problem is, well, this might have been a healthy choice in the Ghanaian environment where you need to survive, you need calories to survive. In our modern environment, it's questionable whether this setting of our body is actually helpful. Is it that we like sweet things? Is that helping us to age in a healthy way? No, because it makes us struggle every day. This is the Kalverstraat in Amsterdam, one of the famous shopping streets, called the shopping street because in the past there used to be shops here, but nowadays it's fast food and bars and sandwich shops. So yeah, am I surprised that half of the Dutch population is now overweight? No, I'm not surprised, because it's a normal reaction to a abnormal environment. And not only is there an enormous amount of food available everywhere and high caloric, dense caloric food, at the same time we don't have to work on the land anymore, and we have roads and train rails to transport us and all our stuff. We have elevators and escalators everywhere, houses full of appliances to take all the manual labor out of our hands. And yeah, the question is, if you look at this picture, which is from the railway station in Leiden, why are all these people taking the escalator? Well, one possibility is that it's an information problem, that people don't know that we have very little exercise, and that taking the stairs is healthier than the escalator. And if that is the case, then I would plea that we print flyers, that we hand them out at the station, explaining to people that we have very little physical activity, that it's better for us to take the stairs. But I think that people know this. I think there's a different problem. The reason that people prefer to take the elevator is the same or similar to why people prefer strawberry cake to broccoli. It's because our bodies have evolved to be frugal with calorie expenditure. If you have, after a lot of work, managed to get a few carrots from the field, you're not going to spend these precious calories just by running around. No. You prefer sitting down to standing up. You prefer escalators to walking, etc. So people are efficient. And you can still, if you give a man a nice suit, like the man in this photograph, yeah, it looks like a modern man, but on the inside he is still the hunter from the African savannah that needs calories to survive, and that's efficient with spending calories to prevent him from dying from infectious diseases because he has no reserves. Okay. I think this picture summarizes it all. This is from the United States. in my problem analysis, the problem lies in the environment more than in the person. This is a bit of a funny picture, but think of it, that we have somehow eliminated all our daily activities from our day by going by car, by going by elevator, by going by escalator. And then we build rooms where we go to at the end of the day to walk in a treadmill without getting anywhere to get our daily exercise, which I think is a weird solution to this problem. Now I'll take you to the Netherlands. This is the country of the Netherlands, and here you see our different provinces. In the 1980s, and in different colors of blue and green, are indicated the number of people with obesity or overweight, a BMI of over 25. So in the largest southern part of the country, 30% of the people were overweight in the 1980s, and only in the north there was one part with 40%. Now I'm going to play time forwards to the 1980s, to the 1990s, 2000, 2010. And what you see is that the Netherlands has transformed from a country where 1 in 3 people were overweight to a country where 1 in 2 people were overweight. In fact, even a little more than 1 in 2. So our new normal is overweight. There are more people with overweight than without overweight. Now you could question whether that is a problem. We could just make the chairs a little bit bigger. And also whether it's right to point so much attention to this. Is this not fat shaming? Is it not time for body positivity? And I agree that body positivity is a great thing, but as a medical doctor, I do feel that I have to find this a problem, because this is the reason that we have over 1 million people with type 2 diabetes in the Netherlands, which is a small country with only 80 million people. This is the reason that cardiovascular disease is one of the leading causes of death in our country. Okay, so that's our problem analysis. Now towards the solution. And this is an artwork in the Medical Museum in Copenhagen, in Denmark. It's a cloak, a coat made out of, and if you come close you can see it, made out of the 30,000 pills, tablets, capsules that an average Hans takes in one day, in 10 years. And if you can imagine, if you apply guidelines to a person like Hans, and if he comes to the GP says, well, the blood pressure is too high. You have a pill for your blood pressure, and here another one. Your cholesterol is too high. There's one pill for cholesterol. Your blood sugar is too high, etc. Is that not right? No, yes, that's evidence-based medicine, because all these pills, they have been studied, and with these pills, people like Hans live longer and longer in good health. But do they solve the underlying problem, the root cause of the problem of Hans? No, because Hans is still a smoker, couch potato, overweight, etc., not eating healthy. And as long as you don't treat that, he'll have to take these pills who bring the numbers down every day for the rest of his life. I think we should take a different approach. The question is how? How do you get people to adopt lifestyle instead of pharmacotherapy as a solution? And this is how it's always traditionally been done. Here you see a medical doctor in an old photograph, pointing at the patient, telling her, don't eat too salt, don't eat too much fat, don't eat too much sugar, go to bed early, eat your vegetables, etc., etc. Well, first of all, it's not very nice to be told what to do. And also, we've just seen it in the past 40, 50 years, this approach has not resulted in a population that is more healthy. Now, we've become more obese, more type 2 diabetes, more cardiovascular problems. And that is because if our problem analysis is correct, then the problem is not in Hans and also not in this woman. The problem was in the environment. So the solution also has to lie in the environment. What does that look like? As an example, imagine that this jar with cookies is in my kitchen. Every time I walk into the kitchen, my eyes register the chocolate cookies and send a signal to my brain saying, chocolate cookies. And then with my willpower, I have to resist and say no to the chocolate cookies. And every time I walk into the kitchen, the same happens. Well, that's not very fun to say no to yourself the entire day. And from my personal experience, I can tell you it's not always successful. So if you want to eat less cookies, you should somehow get them out of your environment. Now, you can play around with this with food for a long time, in schools, at home, in offices, in shops, etc. We have somehow surrounded us with these seductive, sweet and fatty foods, and we should remove them from the environment again. But you can also apply the same line of reasoning for other lifestyle factors that are important for healthy aging, such as sleep. I still remember that when I was in Ghana and I explained that many people have difficulty sleeping in Ghana and that they take pills for that they find that weird because sleeping, it comes automatically, right? Well, yeah, in Ghana, if you're at the Campos place again, at 6 o'clock it's dark. Your body starts to build melatonin. After 3 hours, the level has reached the level that you start to yawn. It's time to go to bed. But what do we do when it becomes dark? We turn on the lights. And under influence of these lights, the buildup of melatonin is completely shut down, which is a good thing because otherwise you would fall asleep during the day. But if you turn the lights on at night and you watch some Netflix and send some angry emails, and then when you close your laptop at 11, you go to bed, you'll lie in your bed with your eyes wide open, thinking you have a sleeping problem. But the problem is not in you, and the pills of the doctor are not the solution. The problem is you have created an environment which does not prepare your body for a healthy sleep. You can apply it to food, you can apply it to sleep, you can also apply it to activity. As long as we keep designing our offices with working places like this, if you park somebody for 40 years in this position, you'll have overweight, a high risk of type 2 diabetes, high risk of cardiovascular disease when he retires. So we should rethink the environment here also. And I have recently, 6 years ago, changed my desk for a standing desk. And yes, it is tiresome, and that's exactly why it's good for you. So I could talk a lot about how the environment shapes our health behaviors, but for those of you who are interested, there's a free MOOC, Healthy Aging in 6 Steps, on the edX platform that describes this line of reasoning in extent. And there are over 15,000 students worldwide that have contributed also with photos from their smartphones to how the environment nurtures and influences their health behavior. So if this is what interests you, this is a good place to look further. Next to the physical environment, there's another environment that's very important for humans. It's the social environment. And I once was invited by the ministry for a talk on physical activity in older people, and I sketched a grim picture that there are a lot of interventions like this. There's a physiotherapist working with older people 3 times a week in a study setting. You see people improve dramatically. They improve metabolically, their sleep, their stress levels, their mobility, their balance, everything. And then at the end of the study, the physiotherapist goes back to their regular practice. The older people go back to the couch. There's a scientific article that says this was a great success, but on a population level, nothing changes. And that evening, this person came to me. This is Herman. And he says, well, what you've been telling, we've been doing that for 6 years with 60 people at no cost. Because we don't need a physiotherapist to do our exercises. In every group of older people, there are a lot of people with experience in also sports training, or they just go out walking together and doing some morning exercises. And I was intrigued, especially because if they did their exercises outside without a professional trainer, so there were no structural costs involved. So I thought this is a scalable model to improve physical activity in older people. So we studied whether this could be copied to a modern city, in this case the city of Leiden, where our university is based, the oldest university of the Netherlands. And we started the Vitality Club in 3 different neighborhoods, a more well-to-do neighborhood, a less well-to-do neighborhood, and a sort of medium neighborhood. And it became a success in all 3 neighborhoods. The club kept growing and growing. People kept on coming. 90% of the people that came also came in the next year. As a medical doctor, I thought, foolishly, that these people kept on coming back because they profited so much and they wanted these health benefits. But, and this is one of the beauties of the Leiden Academy, when I asked one of my colleagues, an anthropologist, to also study this, they started to join these sessions and exercise together with older people, talk to them, and they discovered that it's the social benefits much more than the physical benefits that these people value, and that keeps them coming back. They like to meet people from their neighborhood. So there are many sports associations in town, and they also have programs for seniors, but they attract people from all different parts of the city. Well, these are based in local communities where people know each other, and they value the social connections with these people much more than with these more anonymous sport clubs somewhere else in town. So by making these smaller social communities, people not only exercise more, but they also build a community which also helps each other outside of these morning sessions. They have fun. They enjoy the outside and the social interaction. This is even an old slide, because we now have over 30 vitality clubs with over 1,500 members, and it's still growing every month. And all these clubs are very different because they're free format in a way. They can do whatever exercise they like. It depends on what expertise is in the local group. Sometimes it's ice skating professional who does also ice skating exercises. Sometimes it's more football. Sometimes it's more just athletics or walking. And it doesn't matter, because the point is going outdoors, being active, being together. Now, another example where the community really makes a difference is from Belgium. This is the city of Ghent, and they have a project called Living Streets. And during the summer holidays, people park their car a few streets further away, and the local community, they put out these tables and this artificial grass, and by doing so, they create a shared living space. And I was interviewing a lady of 70 years old. She'd been living in this street for 40 years. And when I asked her what had changed in the past 6 weeks, she said, well, since these tables are there, I am outside much more. And when I'm outside, people see me and they greet me and they talk to me. And children are playing there. There was already a child that had sit on her lap. And the parents of that child had already invited her over for dinner once. And she had already suggested that she could also babysit every now and then. So you can create the physical environment can also create opportunity for a stronger social environment. So this is my last slide. This is from Cuba, and in Cuba you have 12,000 of clubs who are a little bit like vitality clubs. They are Círculos de Abuelos, if I pronounce it correctly. Groups of older people living closely together that come together 3 times a week, not just by themselves, but under guidance of a Professor del Forte, who was appointed through the system of Cuba. And 40% of the older adults of Cuba, 800,000, thus have their exercise 3 times a week, and also their social connection. And this system could well be one of the reasons why Cuba, despite having only a tenth of the health budget per capita compared to the United States, for example, realize a similar life expectancy and a similar or even higher life expectancy in good health. So this is what I brought to you today. I hope that you have also been inspired by Hans and Kwaku, and that you think of them again in your own line of work, and that I've been able to bring to your discussions today some examples from Belgium, from Cuba, from the Netherlands, of community projects where not an individual approach to prevention, but a collective approach to prevention has shown to be successful. And I welcome any comments or questions from your side. Thank you very much.
Thank you, David, very much.